This afternoon's final workshop session is PrEP from trial to reality. And I'm going to ask us to start straight away. I have the great pleasure of introducing Etienne Fouquet from ED in Paris, who is going to talk about implementing PrEP in France, lessons and insights. Please join me in giving Etienne a big, warm London welcome.
Hello everyone. Thank you for your invitation. And I warn you that it's my first presentation in English, so please be indulgent. So I will present you the French experience and how we implement PrEP in France, how we implemented PrEP in France. I am health prevention officer in the new health strategies service in Paris. So let's begin. Everything began with before 2016, of course, and the first step was to prove the effectiveness of PrEP. And how to do that? Of course, we had to do a clinical trial. And so we participated in the ANRS HPE as co-investigator. We recruited participants and we supported them during the trial. HPE, as you know, gives us solid scientific results. It validated the demand-driven dosage regimen, which is something very specific in France. We will see after a monitoring model for PrEP in France at the medical level and for the peer-based support. Of course, we have to fight for access to PrEP. How we did that? By a quantitative survey, Flash PrEP. You know Flash PrEP in Europe, but we did Flash PrEP before. And there was 3,000 respondents. We made classic advocacy in the ministry with parliament and stakeholders. There was also activist mobilization in streets, as you can see on the pictures. And the board of ED decided to prescribe a PrEP illegally. It was not useful because it was just 1 month before the authorization of PrEP. So, but we were prepared to do it. And a qualitative survey about informal PrEP use that we called it PrEP sauvage in France to know how people did that. We also created PrEPdia, which is a Facebook group for PrEP users and their friends. Today there is about 6,000 members on this group. Its role is to share information, to orientate people. It's also useful for research because there were students who ask questions on this group to the PrEP users. It's also a space for debates and for self-support, of course. The virtual support on this group is made in addition to medical monitoring. And what is interesting, there is a diversity of members, doctors, PrEP users, activists, and a lot of other things too. There is no limitation in the duration of interviews, high reactivity, but there is some limits, of course. Some people play the doctor, there is no confidentiality, and the public is mainly MSM. Victory. In November 2015, the Ministry of Health announces the authorization of PrEP and its coverage by public health insurance. That was a little surprise for us. The writing of the temporary recommendation for use 1 month later, And at the beginning of the previous year, PrEP can be prescribed in hospital by hospital physicians. This prescription was extended at CEGID in June. CEGID are the public screening centers, public test centers, I know. And during the summer, as you know, the European Medicine Agency gave its approval for Truvada as PrEP. 2016 was the year of implementation of PrEP. So the first thing to do was to promote access to PrEP by public campaign. We participate in this public campaign. I will show it to you just after. We created promoting documents. I will show them to you too. Newspaper articles and so on. We set up a map of PrEP consultation places. This map is now we gave it to the man who creates the global map in the world. So it's useful for everybody. We organize a conference for gay MSM leaders called Wellovision. This conference aims to promote PrEP, to promote combination prevention among MSM leaders such as NGO, LGBT association, bar owners, porn producers, and so on. As you know, because THT is a part of it, we launched Flash PrEP in Europe, and you can see the results here. Here are some documents we created, or public documents about combination prevention. This one is a public campaign. It was the first time the ministry did a public campaign in the public space targeting MSM people. So it was the first campaign about PrEP, and you can see maybe for gay people, for Black African people too. Activists of head of our NGO have had an important role because PrEP came up in 14,000 individual interviews, which we presented 28 of all interviews we conducted during this year, and more than one on percentage twice as high among MSM, as you see, 56% in 2016 compared with 20% in 2015. We oriented 2,000 HIV negative and HIV vulnerable people to PrEP consultation. We also did collective actions such as information sessions open to everybody, or group for self-support. And all these actions, we promoted all these actions on social networks and on a gay app with online outreach. Here's some pictures of these actions, of these collective actions. Apéro, it's very. Here you have the data of RTU, which is the specific dispositif we launch, who permit to have PrEP in a previous year. So in 2016, there were 2,805 people had access PrEP, mainly men, 37 average age. To the 2/3 in Île-de-France, which is the Paris region. They were mainly French, and as you see, more than the majority was on demand drive dosage regimen. There was only one contamination of a person who was taking PrEP, who was really taking PrEP. And the result was that marketing authorization was accorded by EMA, and it has been set up in France from March. What are the changes? Now the renewal of prescription is made possible for liberal doctors, and the demand drive dosage regimen is unfortunately not concerned by this authorization. Now I will focus on support for PrEP, the peer-based support. There are also official recommendations for it. As you see, the French group of experts recommended that PrEP dispensation should be carried out with a support to the adherence to this prevention tool and the adoption in terms of safer sexual practices for all STIs. And you have other official recommendation for it. What are the characteristics of this support? It's a community-based support, which signifies that there is empathy and non-judgment in regard to sexual practices or substance use or lifestyle. It's support integrated into the medical consultation. It's before and after the medical consultation. It's on-site in the hospital or at Cégide. There is a partnership agreement, and there is debriefing with the medical team, etc. So it's very integrated. One more minute? Yes, it will be okay. Just one or two. Yep. Interviews are about all the sexual health problems, not only about PrEP. There is provision of other prevention tools, and the supporters are available and reachable by email, telephone, text message, and so on. We also promote collective actions in this support group of peers, and we evaluate this action. Here you have the profile of people supported, and if you see it's very small, there is 60% who have a drug use, and there are 65 sexual partners by year. Perspective to conclude the last diap. We have to do the scaling up. The number of PrEP users is insufficient. Of course, today there is 5,000 people under PrEP in France. It's insufficient. We have to promote the knowledge of PrEP among target audiences. We have to work on access to PrEP for other communities, Black, African, trans people, because actually it's only MSM. We have to develop new form of support, and there is a new form of PrEP to come. Thank you, and sorry for my English.
Thank you, Etienne. So it's always a great pleasure to be in the same room as our next speaker, Willy Saruma, community advocate, all-round fantastic HIV and PrEP advocate, who is going to be talking about PrEP, an opportunity to refocus HIV prevention. Please join me in welcoming Winnie.
Thank you. I have to say that I consider myself an accidental PrEP activist, community activist. I literally fell into this role because I'm just passionate about people not getting infected. I'm a person who is living with HIV for 30 years, and I just wish, PrEP was there, a long time ago. But I'm so, once I started being an activist, supporting people living with HIV within the African communities, I also feel very strongly that, PrEP is one of the biggest opportunities for HIV positive communities to link with HIV negative communities and to actually help with decreasing the stigma and to work together so that we can actually improve the effectiveness of the HIV response. I literally think that because of PrEP, aside from microbicides, PrEP is the one HIV prevention that is literally in the hands of women. Women can actually take control of their lives, HIV negative women. And many people know why I'm talking about this. It literally arose from this specific statement that I made on a BBC program. Once they figured out that PrEP wasn't just for men having sex with men, they thought, oh, we can invite Winnie to come and sit on this program to talk about the African or the Black, response to PrEP. So I'm standing here because of that, because of that interview, and also because of my passion for making sure that we make the HIV response more effective and that nobody else gets HIV. So I'm literally speaking from the heart and from the gut about the issue of PrEP. One of the things I did on a personal level when I started to get inquiries about PrEP, personal inquiries, starting getting emails from African members of the community, I thought, where is the work that is being done in African communities on PrEP? Because what was coming across in the media, whether that's print media or television media, was that PrEP was for men having sex with men. And I thought, this is not right. Somebody has to do something. But who's doing it? And I couldn't see anybody doing it. So what I did is I approached the PrEPster guys, as you do, and I thought, how can you guys, support me in helping to get sort of a movement within the African communities, and get some more information out there, on PrEP, because nobody knows anything. And they said, let's work together and train some PrEP champions. So voila, we trained some PrEP champions last year in December. Thank you, Will. And I'm glad to say that some of the champions are in this room, but I won't make them stand up. But it is that single effort, why I'm standing here, that I'm talking about PrEP. We really should be able to do more work within Black communities, African communities, where PrEP is concerned. And within that, look at how women, are able to access PrEP. There are a lot of things that have been said here this morning and in many of the conferences that I've been to. And I'm just going to look at my notebook and just throw some thoughts out there on how we can what we can actually do, and just my thoughts on how we can engage people to, to access PrEP. First, we have a trial. I'm not sure why we are calling it a trial, because we know PrEP works, so it shouldn't be a trial. But also that, for me, says that if I'm going out there in the African communities, I'm never going to say, please get on a trial. Because they will say, no, I'm not going to be a guinea pig. And that will be the end of the conversation. So I'll probably say, get on this pilot project, which is going to be, the results of getting PrEP and making sure that people who want PrEP can access it. So literally looking at the language that we use, with different communities in terms of engaging, them on PrEP and accessing the trial. That is really critically important. When people are talking about combination prevention, I don't hear a lot of people talking about, how they give information or how they engage people, and what lessons we've learned in terms of engaging African communities or Black communities. We know all of this information, and yet when we are using the new communication methods, say the internet, the whatever, we are still not looking at what we've learned. The new digital messages, the new digital forums, the new messages, on how to engage people have to be used in combination with what we know works with the communities. Otherwise, the messages won't get through. So we still need face-to-face, workshops, trainings, what we need to talk to communities out there about PrEP, especially within Black and African communities. The other thing that maybe I can add on to that, I know Will is about to tell me to shut up probably, is we also need to stop talking to ourselves. Why is a positive person talking about PrEP? Why am I here talking about PrEP? This is about HIV negative people. HIV negative people need to be talking about PrEP within Black African communities, and we need to engage them. How many of them are there? There's a meeting I'm going to on Monday, and it's about, women on PrEP, or women and PrEP in Europe. Literally, we've been searching for somebody, a woman, not even a Black African woman, who is on PrEP, and can't find them. This is the situation we're in. Okay. It's dire. It's really dire where PrEP information is concerned, because many people within Black and African communities, and even generally women who are not from these groups, don't think that PrEP is for them because of the way that it has been communicated. I think I'm going to just end on, a few notes and a few questions that I have for myself, actually. Let's stop talking to ourselves and include other people who are working on these issues, or, or even other different issues that we can link with. The epidemic is changing, so are the communities. What do we need to do? Do we need to sit, to stand back and see that, we look at different strategies of actually engaging people? PrEP work shouldn't be left to volunteers. There should be paid people who are working on these issues. And if as a volunteer, I'm here, then somebody should pay me to do more work because I'm passionate about it. The other thing is we also need to find new models, because once we start once we start talking about more work, combination prevention, more work, people think, oh, that's going to require money. Where's that money going to come from? And then people freeze. We don't have money for that work. We don't do this. There are cuts in this. Let's find new ways of fundraising. I keep talking about this, especially when I'm talking to Black and African communities. There are business people within these communities. There are people who have money in these communities. Let's start talking to them and getting money out of them to fund work in their communities. If we can send money back home, we can definitely work with that money within the communities here. Ooh, Will had told me 1 minute. I really think that there's a lot I can say, but one of the things maybe that I can say last is that working in partnership is definitely a good way forward, but those partnerships have to be equal, whatever they are. They have to be equal, they have to be efficient, they can't be just convenient in terms of how we work to get people to access PrEP, especially in communities that are very much at high risk. Thank you for listening.
So thank you very much, Winnie, for some passion there. It's always good to hear.
I'm Catherine Dodds from University of Glasgow. So thank you very much to all three speakers. They were really interesting talks and not necessarily what I was expecting coming into the room. So in a very good way, thank you very much. Winnie, I think in particular, I think you raised a number of questions for people to consider, particularly about the impact of the introduction of all new technologies on the groups who are likely to be most marginalized. And I think that's the kind of question that we need to ask every time a new technology is introduced. So thank you for that. So I'm just going to refer on to my notes as I go. Winnie, you said, I don't know why we're calling this a trial. I think I have an answer. The construction of the next rollout of PrEP in England as a trial is a construction of a regime of power, basically. It's a means of keeping control and keeping a lid on PrEP by people who are concerned about the implications of it. I think particularly concerned about the cost implications, but those aren't the only ones. I do notice that, as far as I'm aware, the people who were responsible for making that decision aren't here right now, but I might be wrong. And maybe some of them need to be in other sessions, or maybe they've had to leave. But basically, I think it's very interesting to look to the experience of France for people who might be concerned about what would happen if we actually just licensed PrEP for use and didn't introduce yet another trial. You know, France has a similar sized population. You're our next door neighbor in Europe. There are lots of comparable things that we can say between the UK experience possibly and the France experience. You've had PrEP available for the last year and you have 5,000 users, almost all MSM. I think we can probably all assume that's what we're going to end up with here. So those concerns about the barging down of doors and the fact that it's completely unaffordable, if we look at the experience of our neighbors, I just don't see any justification for that concern. So really, my question to anybody here who might be able to answer it is that if we disagree with the premise of this trial, if we want to complain about any of its potential delays in starting, which I think are likely, if we want to complain about the disarray, about the staggered rollout, which it has been announced today is going to happen, which I think will cause an enormous amount of confusion for potential PrEP users in England, then who do we write to? Do we write to the PHE? Do we write to the Department of Health? Do we write to NHS England? Do we write to Brian Gazzard, who's the PI of the trial? And I don't know what the answer of that is. That's not a hypothetical question, it's a real question. So that's my question.
Okay, so I'm going to see if there's anyone other than our panel members who want to respond to Catherine, and I'm not looking at anyone in particular, and I also realize that colleagues from PHE have some level of things that they can't say in a pre-election period, so I'm not going to put anyone on the spot. But are you responding to Catherine's? Yeah, okay.
Thank you, Paul Clift. Just in response to that comment you made about the NHS England and the cost of the trial and the cost of rollout of PrEP and the slow uptake, essentially, initially of it. Yes, and that struck me with the French presentation as well. I was a member of the ill-fated policy writing group, PrEP policy writing group for NHS England, and I can assure everyone in this room that we were telling them over and over and over again that there would at the very least be a very slow take-up, if not a prolonged low take-up, and that's been ignored by high-ups. And I really wish I could remember the person's name who told us in a phone call in March last year that they were not going to go ahead with it. But if I could, I would quietly let you know.
Paul, did you have your hand up for a question? Yep. Okay, but let's go to you next then.
Okay, so I suppose it really follows on that, and I suppose it's about building that evidence base, although I'm sure everybody's thinking how much more of an evidence base do we need to build up. But it's a really open question to Etienne about the French epidemiology. This morning, I don't know if you were here for Valérie Delpech's presentation of the reduction in diagnoses last year, particularly in London. And I was just looking on my phone at the VIH.org. So you've got similar sort of population, similar numbers of new diagnoses in 2015, similar numbers in MSM, though slightly lower, about 2,500 in France in 2015, 3,000 in the UK. I was just wondering if in 2016, since PrEP's been much more widely available in France, have you seen a sharp reduction in new diagnoses, particularly in MSM? Because if you have, which you would expect to see, then that adds to the evidence base which is being built and being shouted about, that makes even more of a case for adding PrEP so much more into that mix for the UK. Did you understand that? I'm sorry if that was too wordy.
No,
My French isn't as good as your English. I couldn't do it in French.
we didn't see an effect yet in 2016. We hope we will see it at the end of this year. But we have not the same health organization than yours. You maybe the number you had on London. Maybe if we look at some Parisian clinic, we could see this reduction, but in the national number there is the same number than the previous year. So no, not yet, but we hope. That's what. Okay.
Any more comments or questions? Okay, I'm going to ask a question and also use this as an opportunity to plug an event and a new film. Prepster is launching a new film called PrEP 17. There's a bunch of cards and posters for it just outside on the Prep and I Want PrEP Now stall. It's a 35-minute film that picks up Nick Falstall's film from 2 years ago about the Proud trial, and Nick returns back to London and does interviews with 17 activists, PrEP users, former users and clinicians to find out the story about what happened to PrEP after the Proud trial results came through. And the launch event for that is a week today, the 25th of May, at Block South down in Vauxhall. You can get free tickets for that event and also find out more from prepster.info/prep17, plus all of the other events that we are doing around the UK in coming months. It will also be available for download for free from a week today as well, so we would love anyone to just take that film and do whatever you would like to do with it. Linked to that, here's a question for both Winnie and for Charlie, and this is based, Winnie, on the comment that you made about finding it really hard to find a woman, including a female PrEP user, woman PrEP user. When we were looking for people to interview for PrEP 17, we looked everywhere we could. We put roots right into every single social network that we could to try and find a black, gay or bisexual man who was a PrEP user, and we just couldn't find anyone. We couldn't find any women who were PrEP users, and you've kind of alluded to what that might be. Have you got any final thoughts, so both Winnie and Charlie, about what the hell we should be doing to really get down and make sure that information about PrEP and voices of PrEP get into our communities of women and into our communities of MSM of colour?
Well, if I had an answer to that, you know I wouldn't be sitting here. I would be minting. But I really don't have a direct answer. I do think that we need to sit down with organizations that are tasked with doing the work around combination prevention and look at how we move forward with a different intervention where reaching these particular groups are concerned. Because at the moment, either the work is not being done or whatever is being done is not working. That's all I can say.
Charlie?
So I think that there are some key things which might not help, but might help a little bit. So I think one of the first things is that with some exceptions, Black, gay, and bisexual men have not been taken account of within health promotion in a big enough kind of way in the last, I don't know, maybe I'm going to say 10 years or so. I think that often the involvement of Black, gay, and bisexual men in health promotion is quite tokenistic. So often you'll get a poster for a testing service and it has a black man that looks a little bit gay. And that's the involvement of Black, gay, and bisexual men in health promotion, and that's pretty much it. So I think that there's something, I think we need to be honest about the fact that we've not done that very well. And that we need to be making specific efforts to engage with Black, gay, and bisexual men around this. When we were doing the interviews, the question that I almost always got was, why are you doing this study with Black men? And it was from Black men. There's not an acknowledgement within the Black community that Black, gay, and bisexual men are at greater risk for HIV than white, gay, and bisexual men. And that's because we don't target or which makes sense to them, or which fit their lives and are respectful and celebrate them as
Just before everybody else. Nice and quick though, please.
How about speaking to Black Lives Matter and ask them to do your engagement for you? You've probably got more chance.
Okay, so we do have one. Do you want to? Yeah, Paul? No,
I just think that's the problem with a lot of this work. I mean, it seems that the whole agenda is preaching to the choir. I mean, women and girls, the chances of them walking into a regular gum clinic that's populated predominantly by MSM, a great example of work is Clinic Q. I mean, I have no right to speak to the trans voice, and I have as much in common with the black angle on PrEP as Fly to the Moon. I think Black Lives is a really interesting way to go, but there are 1,000 black specific agencies and women and girls agencies who might be more appropriate and useful to engage in this conversation than just the usual suspects.
Do you want to do one more really quick comment here, and then we will stop?
Yeah, we need, I mean, it's very important actually working with African communities. But I wonder whether it is possible, as point of care testing is very important in the community and is taken mainly by local authorities, public health, whether the issue of PrEP also could be linked with that, with local authorities, which is very important, taken as prevention for HIV.
So We do have to stop, I'm afraid, and I've had three things that I need to remind you of. I need to remind you that the slides will be available from today's sessions online in the coming couple of days. I need to remind you, please, to complete your evaluation forms that are in your pack, and as if you needed reminding, there is a drinks reception at 5 o'clock in the Wesley Hotel. The map of how to get there is in your pack. And my final reminder, we would love to see you at one of our PrEP 17 events. Come and grab a postcard or a poster from a stall. Please join me one more time in thanking our speakers today.